If you've ever lost someone close through illness, there's never a day that goes by where you don't think about them and just how hard they fought to stay alive. It's the same experience that families across Australia and around the world go through each and every day. That's why your generous donations gives the most precious gift of all to those who face the same ordeal: time. Time to fight another day, and time to spend with loved ones. And most importantly, time enough so they can beat their illness and go on to live full lives with friends and loved ones. Your donations will go towards helping establish the Nelune Comprehensive Cancer Centre. Sitting within the Bright Alliance at Prince of Wales Hospital, it will become a world-class cancer care centre, providing a place where patients can fight cancer with dignity, and also a new bone marrow transplant ward at St Vincent's Public Hospital, which will help St Vincent's treat more patients and save many more lives.
My name's Verity. I live on the Northern Beaches and I just work in the city studying to be a nutritionist.
Dale Levy, ex-South African, been here 18 years and 12 days, but we don't want to be exact.
My name's Julie Elcher. I'm 50 years of age, I'm married, and I have two beautiful daughters.
My daughter Tessa is 20-year-old. She's a fourth-year medical student at UNSW.
Well, my name's Peter Wilkinson, and for most of my career I've been a journalist for 30-odd years.
My name's Jill Rosen, and I am a speech pathologist.
My name's Jacob Week, and I'm 20 years old.
I was diagnosed when I was 17. It was actually halfway through my trial HSE exams, and they didn't really know what it was for 2 days. They kind of tossed up, could have been anything, like anything, because it was a blood disease. Turned out to be severe aplastic anemia.
I was having a bit of trouble in the toilet. I went to see my doctor immediately, GP, and he sent me for blood tests straight away. He found me straight away when he got the results and sent me for a colonoscopy. And when I came out of that, the professor came out and said we couldn't get the scope up because the tumour was so big.
It first started in March. I actually had a back pain. Didn't think much of it. And it wasn't until probably around end of April that at home I collapsed, and when I came around I couldn't move my right leg. So I did a few scans. They actually at that time said to me it was metastasis and it was aggressive. They did not know what the primary was. So at that time for us it was really tragic, because it's when you hear something like that it's more terminal illness. And then I was referred to another doctor, which was Professor Robert Lindemann, and then he was the one who said to me, you've been diagnosed with non-Hodgkin's lymphoma, bone cancer.
She's just very special. Happy, healthy, sporty. That was prior to April the 20th, when we got a phone call saying that she'd had an MRI and it showed she had a brain tumour.
In early 2012, my blood levels dropped, all my blood levels. And it turned out that my stem cells weren't actually producing enough blood cells to keep up. And so my blood cells were going into gentle decline like that. And I was diagnosed by Dr. Moore at St Vincent's with myelodysplastic syndrome, MDS. And in that consultation, he told me I had possibly had a number of months to live.
I was diagnosed with leukemia in the end of 2012 and had a lot of my treatment at Prince of Wales coming here for my bone marrow transplant in April 2013.
It started off as just a kind of lump in the leg, we thought it was a DVT because we just got back from Hawaii. So we thought it was a DVT in my leg, and then it's just the swelling, and then, you know, pain got worse, so we just got more tests and found out that it was something more sinister.
I think we're still coming to terms with it. It's been the most bizarre, life-changing event that I've ever experienced. You know, when you get to be an old fart like me, you reckon that you would have experienced most things as a father, as a parent. But this one was knocked us for 6. Yeah.
Scared at first because I didn't understand it. You know, it all comes down in a flash type of thing. You don't know what's really going on. Yeah, I was really scared.
As soon as you hear the word chemo, you kind of freak out. So anyone does that, and like, you don't let yourself think the worst. And I was lucky I was quite naive because I was so young and hadn't really been exposed to much illness throughout my life. So yeah, just scared, but at the same time, lucky.
I'd kind of convinced myself that I'd had some other autoimmune disorder like lupus because I had the symptoms that I had, so I wasn't expecting it at all.
Well, upon getting that diagnosis, I passed out. And because it was completely unexpected. I've been healthy. I'm a bit north of 60 and I've been healthy all my life. And so the last thing I was expecting was a serious complaint. There's nothing in my family, nothing at all that gave me any expectation of being crook. So when I was told I may die, it had a profound effect on me. And for the next few months, I worked very hard to adjust to the idea.
Just had to put a hold on life for a while, and, you know, take a few steps back. The side effects of, you know, treatment and stuff, and, you know, all the side effects, I guess, affects my life and, you know, social life, and being in a wheelchair now, I guess it's all different.
When we first got the diagnosis, it was really tragic. It was, sorry, I don't sorry. Sorry. Do you want a drink? No, it's all right. Sorry. Oh, good thing. Yeah, it was pretty hard for us, and for me mainly because I've got 2 daughters, and that was really, I just looked at them and I thought, as their mum, I have to be here for them.
So the facilities as they are now are fairly rudimentary. I think it's fair to say that this would be one of the oldest hospitals in Sydney that's not had a substantial upgrade. I think the staffing are extraordinary, but it's the physical layout and the physical structure that leaves quite a bit to be desired.
When you walk through those doors, you want to feel that you're comfortable, and it's not an environment like a hospital environment, because that gives you, it gives you a more positive outlook.
Even having a place that is different and new and comfortable raises everyone's spirits and helps them fight what is a very difficult time for them with some dignity and comfort.
When you have good facilities, staff morale rises, and when staff morale is good, patient care is maximised.
From what I hear, the new ward will have private rooms, which is absolutely necessary, not just because I was at an awkward age between adulthood and being an adolescent, but because cross-infection is so common, and it just makes you feel that much worse in the peak of treatment when you have a flu, because you don't know if it could turn into pneumonia, if you don't know if it could turn into just a simple chest infection, but it's a ripple effect on your whole family. You just want to avoid it.
So with the new ward, we propose to have 16 single rooms, which will give the patients privacy, and it's a very difficult emotional time. So having that single room will give them that extra comfort that they need during that period.
And a lot of the time the families are more upset than the actual patient. and to have this fantastic facility where they can sit and just talk quietly, well, some of them not so quietly. It'll be fantastic.
Because I'm an adolescent, I'm kind of like a lot of older people down in 4 East. If there was more adolescents, you know, just with themselves, and Wi-Fi, and maybe food, better food, I guess.
Within the new centre, when the centre's built, there will be areas where is specifically for this age group that will be adapted and care for their specific needs.
And it's really trying to bring the ward up to world best practice, and this is what is being done all around the world. And with that, we hope that we'll get better outcomes for the patients, but also better emotional outcomes for them as well.
Because I can tell you that my father, when 5 years ago was diagnosed with cancer and he passed away, he didn't have these facilities, and it was very hard for him, and it wasn't nice for us as the family watching a loved one dying from cancer. If he had a bit more support, or if he had these more modern equipment or facilities where it made him more comfortable, it would have been fabulous.
Well, the Nelune Foundation has been invaluable to us. We had to relocate as a family to Sydney. We don't know Sydney at all. We don't know the area. We had to look for accommodation. We were linked up with a driver, Jeremy, who is very caring and very careful. At the time we first started needing transport, just after Tessa's operation, for us to be able to get backwards and forwards between our accommodation and the hospital for the many medical appointments that we have has been an incredible help.
The feedback I get from patients who try to get treatment for themselves and for their loved ones is that it's few and far between. And I think if people support, it will only help the foundation to provide these practical services which are so desperately needed. And I would encourage everybody who can to give whatever they can, because it's all helpful.
I would love to see the Nelune Foundation grow to a point where it can provide more services.
What we're looking for in this current fundraising drive is to help us with the inpatient needs of patients, which hasn't been a focus of Nelune thus far, but I think it's particularly important because those patients who are inpatients are very sick and need all the support that they can get.
Well, without the donations, then the charity's not going to be able to, or the foundation's not going to be able to develop and support what's happening within the new centre. And the more donations we get, the more adequate and first-class the services are going to become.
And with groups like the Nelune Foundation, I think we can be proud of the care that we give our patients, and that little bit extra makes a massive difference to patients. So those sort of organisations such as Nelune continue to be extremely important in providing care for these patients.
I think the support services in the hospital have been fantastic, the specialists, the nurses. I think they're under a lot of pressure. And I think what something like the Nelune Foundation does is it seems to relieve that pressure a little bit. So my advice to others would be to look for those areas of support. And I think after you've been through a situation like this, I think the thing I'm thinking about next is, okay, how can I help the Nelune Foundation? How can we give something back? And at some point, we're looking at exploring that.
The Nelune Foundation is quite exceptional, really, because it was started by one or two individuals, and it's really grown significantly, and it's reached out to a lot of people, relatives of cancer patients, people who know patients with cancer, and it should be viewed in a way that it's not just for cancer patients and relatives of cancer patients, but it is a community project so that they can hopefully feel a sense of engagement, a sense of belonging, and a sense that they're making a difference.
Life is so precious. We've got an amazing opportunity to help make lives better. So dig deep. There's so much at stake. Please, Give generously.